As people work to secure COVID tests, the antigen variety are becoming more and more frequently used.
But how accurate are they, and should you trust one negative result? Local 12's Christian Hauser talked with a local expert to find out what you need to know before putting your faith into that result.
Hamilton County Public Health Medical Director Dr. Steve Fagan says that these antigen tests were authorized for symptomatic people to detect COVID, meaning someone who had no taste or smell, coughing, the usual COVID symptoms. But now they're being used in many more circumstances. Those tests are now being used by people who may have been exposed to someone with the virus, or maybe someone who wants to make sure they don't spread it at a holiday party, or even just cleared to play a sport or go back to work. But Dr. Fagans warns one negative antigen test result should not be enough to clear you. He says you should have two negative results.
One negative antigen test probably isn't enough. Really, it's more like a two in series. Unfortunately, that period of time between the two should be more like 2 or 3 days rather than a day or even a few hours.
What about the whole test to stay thing for people who, maybe unvaccinated, a requirement of work, that sort of thing? I guess how should we be handling them?
Yeah, and once again, it goes back to, it feels like the pandemic starting all over because there are a lot of well-meaning individuals in all levels who are trying to come up with ways that we can do things. And so test to stay is one of those things, and why until something better comes along, that's what we have.
So the point is, at least for right now, it's the best option until something better comes along. Dr. Fagan says he's against trying to use the PCR test for programs like Test to Stay simply because there are not enough PCR tests out there to keep up with demand. One positive note for the antigen test is so far, they appear to be equally good at detecting all variants of the virus. For Local 12 News, I'm Christian Hauser.
Well, the antigen tests are doing well at detecting these new strains. The FDA has had another issue pop up: expired antigen tests. Many sat unused beyond their 6-month expiration date, and now the FDA must make sure those are still able to detect the virus. The good news, though, the data shows that they are continuing to work.